HeartPath started in the Mission Hospital in 1983, so it's been in the community for over 25 years. And it's more than a structured exercise program, which is what people think of predominantly. It is stress management, it is nutritional counseling, it's a support group for all those that attend. So it's a wide array. We meet a lot of needs in the community. We have a variety of staff members. We have registered nurses, we have exercise specialists, we have exercise physiologists, we have a respiratory therapist, physical therapy assistant, we have RDs, which are the registered dietitians, we have the support group that goes with all that, the clinical and clerical. Approximately about 20% of the people that call us to enroll in the program, as we are asking them questions, they tell us that they would really like to come to the program, but they can't afford it. They may have Medicare, but they don't have the supplement that goes with that, so they don't have that resource. Or they're either Medicaid or they don't have insurance at all, and especially with the recent layoffs in our community, that is a problem that we're seeing more and more as we make those phone calls. We get patients that have had heart attacks, we've had patients that have had bypass surgery, stents. They don't have to necessarily have had the heart attack before they get the stent. We get valve surgery, we get patients that are just wanting to get better in a primary sense, that they may have not had an event whatsoever, and with a doctor's referral we can actually get them into the program, into just changing their lifestyle. The goal is to get them before their event if we could. And so that's what we would prefer. Well, Medicare is our predominant insurance carrier, obviously. If you're 65 or older, you've got Medicare, and they pay for the 6 diagnoses: the heart attack, the bypass, the stent, the stable angina, the valve surgery, and heart-lung transplant, which we don't get a lot of here. But the maintenance part is out of pocket. That is where people have to reach deep and pay for it themselves. They have an opportunity to exercise 5 days a week, and that $55 allows them to do that. It also allows them to see a dietitian anytime they want, or to participate in stress management. After every class, we have some component of relaxation so that we can teach them the mechanisms of reducing their stress. Patients will ask us, well, why would you come to HeartPath instead of going to a local gym? What's the benefit to them? And what we tell them is that we actually care whether they're actually exercising, are they actually showing up. When you go to a local gym, normally they're not going to do a follow-up if you've been missing for 2 or 3 days. And the HeartPath staff will actually pick up the phone and call them and say, where have you been? We're missing you. Is everything okay? Because we want to make sure that we know where they are, if everything is physically okay with them. We also have nurses. All of our nurses are ACLS, Advanced Cardiac Life Support, so that if something goes wrong here, we can actually take care of them. So that's kind of a difference. We do medically supervised exercise programs, and so everyone here knows the CPR, and the nurses have the ACLS. Even our doctors in the morning that are here have that, and then we're covered obviously by the cardiologists in the same building that we're in.